that we'll post. Finn will give us an update on our activities, the projects that ANZGITA is running at the moment. And then Chris Hare will give us an update on virtual educational activities around the Pacific. And then Collin, our guest speaker, Collin Tukuitonga from Auckland, will take a broad look at healthcare development in the Pacific as our guest speaker. So just before we begin, I'd like to remind everybody about a couple of little things, marketing items. We've got our socks still on sale. They've been a huge hit and the best seller, by the way, for the Sydney Sock Project. We've got another one coming up pretty soon, and we'll let you know about that. Also, the About ANZGITA presentation that we put together that you can present to your colleagues. It's just 10 short slides. Do you want to move it, Frank? It's 10 short slides that you can present to your colleagues at lunch. We've had our first person do that, Kim West in Queensland. So we'd like to thank her very much for sharing that. She said she had a gas telling everybody about her experiences in the Pacific. And then I guess that's it. The slide deck for this helping About ANZGITA is either a flip book, so you can do it on your iPad, or it can be a PowerPoint presentation. So also we have a GoFundMe page for Tonga, raising money for the Viola Hospital in Tonga, but Finn will tell you about that a little bit later. So we'll get started. Our chairman, Professor Finlay Macrae, will take it over.
Thank you, Barbara, and thank you everyone for joining the members meeting this evening. We thought it was a good idea to keep you all updated, given the contingencies of the last 18 months or so, just to indicate we're still here active and, as you'll hear, working pretty hard. So next slide, Frank. So apart from actual training activities, we've been quite substantially involved in developing the support services for the centres, many of the centres in which we've worked. We've had 3 sterilisers that we've managed to purchase at a rock bottom price, but they're very good sterilisers that became available through Queensland Health, and they are being deployed in 3 of our training locations, in Fiji and Timor and in the Solomons, I think, and a couple of drying cabinets are also being installed. So that's involved quite a bit of money that's come through our market, through our fundraising processes. And Di, I'll tell you more about that next time. We've joined with the WGO and are placing for the first time electronic medical record endoscopy reporting system in Fiji, and the WGO is very keen to see how that works and if it can be rolled out to one or too many of the 23 World Gastroenterology training programs if it works. That's a pretty new process. It's just starting its real-time work at the moment as we speak with the meeting in Fiji. We've also worked with the WGO in establishing a sampling process of tissue from the stomach at the time of gastroscopy to look at not only the prevalence, but particularly the antibiotic resistance patterns of those Helicobacter in association with our colleagues in Portugal and Peter Catalaris in Sydney. I just want to mention COVID briefly. Brian Freestone is a member of our advisory board, and he's been actively considering opportunities to discuss with and engage with the Department of Foreign Affairs and Trade. And one of the things that's likely to come up is what, if any, is our role in supporting the deployment of COVID vaccination across the Pacific. And this is a matter that the board will be considering next Monday. But we're just putting it up here as a kite flying episode and alerting you to the fact that this might be something that we have certain expertise in assisting what's an urgent need, for example, in Papua New Guinea. That'll be ongoing discussion, but it'll be board directed initially. And Myanmar has been special to our hearts, of course. We've been in pretty close contact with our peers in Yangon, felt their pain. They're all in the civil disobedience movement in Myanmar and highly constrained in terms of their clinical activities under so much pressure. And we feel for them. That, of course, is keeping us well away from boots on the ground in Myanmar, as is COVID. But just to let you know that we haven't forgotten Myanmar, and we're emotionally very much involved still with their plight. So next slide. Barb mentioned the endoscopy room in Tonga. They've reached out to us to see if we can help in building the bricks and mortar associated with an endoscopy room in Tonga. ANZGITA has committed a seed amount of $6,000. We've established the GoFundMe campaign through our networks, and we need another total of $10,000 to enable this endoscopy room to be established in Tonga according to the needs of our colleagues and peers in Tonga. So please think about that in terms of the opportunity to engage through the GoFundMe campaign. The benefits of that are pretty obvious as listed there. Next slide. So I'd like now to introduce you to Chris Hare, who you all know. Chris is going to update us on what's been necessarily a transition to virtual programs of training across the Pacific particularly. And he'll, and Chris, we're all very grateful for the enormous energy you put into this and the lead position that you adopt, not only for ANZGITA and the region, but indeed for the world in terms of your initiative and engagement. So Chris, over to you.
Thanks, Finn. Thank you, Finn. Well, firstly, just a welcome. I was looking through the members that are attending today, and a very special mention to Prof. Moriyama from Japan, Vikash and Amini Miniasi in Fiji, and of course our close friend Rooney Jagili, who's calling in from the Solomon Islands, notwithstanding the team from New Zealand as well. The initiatives, I mean, ANZGITA has been pretty well placed to transition to virtual teaching, at least in a Zoom-based sense, having commenced education by this method in 2018. It's been a natural transition through 2020 and then this year to think about how ANZGITA might provide virtual education, our core value, to our colleagues and partner centres during the COVID pandemic, but particularly putting us in a position to do this on a more regular basis, notwithstanding the importance of doing in-country training and visits. Our webinar program, we'll run through that briefly, but I'm really proud to say that that's been developed with Vikash and Amini in Fiji, as well as Mei Ling in her role as the president for the Internal Medicine Organisation. And we have a full set of ANZGITA members prepared to present topics this year and also host case discussions, and extending the moderators to that to Finn and Chris Kiley, amongst a few others. I'll skip to the ANZGITA WhatsApp endoscopy group. This was an initiative from Rooney Jagili to bring to a broader sense some endoscopy-based cases and learning to the broader Pacific. And what's been a slow start may actually gather some great momentum as this has been put in the hands, at least of our colleagues at in the surgical side at FNU, Rooney, through Sonal Nagra. And there's both a project in this, but particularly a surgical ownership of this that we'll see developed later this year. I think if Di's on, we'll ask Di shortly to speak about GI nursing and the tele program to bring virtual teaching to our Pacific and Asia Pacific nursing colleagues. And I'll very briefly wanted to talk about virtual live endoscopy mentoring as a vision for perhaps how we might move into the future. Frank, next slide. So this is just a rundown for those that are interested in our teleeducation webinar program. For those uninitiated, you're more than welcome to join at any stage. We run this as a more or less a 15-minute topic presentation, followed by case-based discussions, which are entirely interactive. The key is to really make this a Pacific-focused, predominantly medical this year webinar-based series. And it's the discussion amongst colleagues in the Pacific with some moderation externally that makes this a really unique program. So this will be roughly the fourth year of running this style of program. And as seen there, the curriculum is predominantly this year based around liver, and again, articulated by Vikash and Amini and Mei Ling as the need area. I'll put in there that Chris Leong is presenting on the 16th of July. There is a space there. We'll go down. I just wanted to point out that we were contacted through last year. We were probably one of the first organisations to bring COVID preparation webinars to our colleagues, our clinical colleagues in the Pacific, and these were probably a very successful start, which then grew across Australia and New Zealand to bring further education. But the same group run predominantly through Meru Shield at the National Centre for Epidemiology and Population Health in Australia. Meru has a lot of experience in the Pacific region, both in PNG, Fiji and other places, Tonga, in public health. And so she contacted ANZGITA in the hope of bringing some clinical education around COVID vaccines, safety, communication, hosted by her and presented by some Australian experts in that region. And through our networks in the Pacific, this will be presented over this period of time, over the next 4 weeks. I think ANZGITA members are welcome to join, but the conversation really is directed around what are the needs and questions from the Pacific peoples. Next slide. That's just a nice slide that Barb wanted me to put in just to show you our telemed model, and perhaps relevant for Prof Moriyama, who joins us today, again from Japan, highlighting that enormous network of people, of Pacific peoples that are welcome to join our webinars. And perhaps for those uninitiated, we just to highlight, we've got groups that attend regularly from Palau, Pohnpei, Kosrae, Ebay, Majuro, all in the Northern Pacific. The Samoas, American Samoa, 2 locations now out of Fiji, Vanuatu on the occasion, East Timor on the occasion, but have trouble with access through internet. Tonga very regularly, and Solomon Islands on the occasion. Next slide. And just finally, from my side, was just presenting this vision that we sort of are developing a little bit at more of a global level, which is whether or not we can start to think about how to provide remote teleendoscopy mentoring, something to do outside of training times. This is our first case of telementoring that Mei Ling and I, Paul Clark, did with Payne Perman from Pohnpei, which allowed the successful diagnosis and management of a benign esophageal stricture, which would have ordinarily been sent out to the Philippines, but Payne was able to do that remotely in country with our assistance. Next slide. Which has prompted more a global interest in whether or not we can do this. And members of the WGO, predominantly endoscopy focused committee, and Andy Veach, that should read, Vivek, Paul from the Mayo Clinic, Mei Ling Amini, Des Ledden and myself, amongst a few others, are interested in working out what limitations and benefits there are in this project. And we hope to use Palau as a test site with Myra, who's up there, who's very interested in having some real-time virtual endoscopy monitoring. mentoring. Next slide. So that's it from me, but perhaps if Di Jones is there, Frank, Di might like to speak to the nursing program.
Mute. Can you hear me?
Yes, Di. Yep.
Okay, thanks, Chris. I can see my name up on the screen. I can't see anything else. So just a brief update then. We're looking and we're in the throes of developing a suite of lectures for the nurses that will be delivered both as a Zoom presentation live, and they'll be recorded so they could then also be used after the presentations. The idea would be to run them at a time for different sites when it can suit them to get a group of their nurses together to do a Zoom meeting. There's 12 ANZGITA nurses involved, and it's likely that our first video will be ready to run early next month, early May. So Karen Kempton and I will organise the people around the Pacific, set up dates for them to have a session with us and to go work through those various topics. So this is our attempt to try and get some nursing education across the Pacific virtually as well.
That's good, Di. Is that going to be a foundation for the Myanmar nursing programs as well?
Oh, shit, sorry. Oh,
Mute. Yes, Finn, it came out of that program that I was setting up with 1010. So it could be, we will tweak them obviously for the individual sites in the live presentation, but the basic information will be the same in all of the sites.
Barb, have we got time for some questions now, or should we move on?
We do, and we've got about 10 minutes actually. If anyone wants to ask a question, just hover over the bottom of your screen and ask them in the Q&A box.
we haven't got any questions at the moment.
At the
Finn,
moment,
so maybe
okay.
if we move on and we can then come back later.
We'll have more time for questions at the end if anybody wants. Yeah.
So it gives me great pleasure to introduce our guest speaker, Associate Professor Collin Tukuitonga, who is a native of Niue Island, trained in the Fiji School of Medicine, and has a Master's in Public Health from the University of Sydney. He's got a grounding in general practice and did postgraduate studies in San Francisco. His career has been spectacular. Former Director General and Secretariat of the Pacific Community, a regional intergovernmental organisation that works on development projects with Pacific Island nations. A former Director of the Public Health Division and Chief Executive of the Ministry of Pacific Island Affairs in the Government of New Zealand, and has coordinated surveillance programs and preventions of chronic non-communicable diseases at the WHO headquarters in Geneva. Indeed, he's former Director of Public Health in New Zealand's Ministry of Health and a founding member of the Niue Arts and Culture Festival in New Zealand. So, as Associate Dean of Pacific Medical and Health Services faculty at the University of Auckland, he's generously agreed to provide us with our keynote speech for the members' meeting. So I welcome Collin, and we look forward to hearing from you.
Well, good evening, and thank you very much for the opportunity and for the kind of invitation to share an overview, really, of the status and impact of healthcare development in the Pacific. I have a few slides that I want to share with you, and obviously happy to answer any questions at the end. It's a fairly big topic, so I'll just try to pick out the things that I thought might be of interest. Next slide, thanks. I thought I would just provide a little background and talk about some health challenges. Given the fact that you're in training, I thought I'd just point out some pertinent issues with regard to funding and workforce in the Pacific, talk about healthcare developments and some conclusions. Thanks. As you know, this is healthcare development in the Pacific is a huge topic. Currently, of course, the biggie is COVID-19. Fortunately, many of the small island states remain COVID-free, but it's an enormous topic that's occupying most at the moment. I do want to just point out two of the as dramatic as COVID-19 is, hopefully it's time limited, and sooner rather than later it'll find a place where it doesn't cause too much grief. Meanwhile, NCDs and risk factors, diabetes, heart disease, some cancers is the biggie in the Pacific Islands. And of course, climate change, the climate crisis and the health impacts of the climate crisis is the other big topic. So these two topics, NCDs and the climate crisis, are probably the two main challenges in the region at the present time. Many other topics, and I'm happy to answer any questions if people are particularly interested in any of this. The third area I want to talk briefly about is healthcare systems, particularly funding and workforce. Next, thanks. This is some work done by my friend, Professor Don Matheson, a little while ago now, but what he's shown here is that, in fact, the Pacific region is not doing well in about 2005-06. If you looked at child mortality under 5, we've stood still while the rest of the world continued to improve. So you can see the Pacific in the red line, they're not declining as rapidly as the rest of the world. Next. If you look at life expectancy now, the Fijians will contest this, but this is some work done by my colleagues at SBC showing life expectancy for men and women in Fiji in the last 2 decades to 2020. And as you can see, from about 1990 onwards, for both men and women, life expectancy has plateaued in Fiji and quite possibly declined. Next, if you take Nauru, of course, is the island that probably taught us a lot about the early days of NCDs in the Pacific region, particularly diabetes. As you can see, again, for women, it's declining, hovering around 60 years. And for men, life expectancy, in fact, peaks in the mid-50s. It's not fantastic. So, and most people would, and this is good work done by friends and colleagues out of SBC, verified by a number of sources, from a number of sources. And most people will tell you that this is to do with NCDs, particularly diabetes and heart disease. Next. There is some good news. This is Papua New Guinea, but it's happened right across the region. Child mortality, infant mortality, and under 5 mortality. In this case in Papua New Guinea, as you can see, it's a commendable decline over the last 4 decades. And if you think about Papua New Guinea, probably the most challenging of the islands in the region, even there we've seen credible decline in under 5 mortality and infant mortality. But as I say, this pattern, this trends have been seen right across the region, thought primarily to be due to improving socioeconomic conditions and nutrition. Next. But the main challenge, as I mentioned earlier on, is NCDs. The top picture is a picture of the Pacific Island Forum leaders meeting here in Auckland in 2011, where they collectively agreed to declare that the region was an NCD crisis and declared war on NCDs. The bottom picture is a combined meeting of health ministers and health and finance ministers from around the islands in Honiara in 2014, where they adopted what is the main policy instrument for the Pacific Islands called the Pacific NCD Roadmap. The roadmap has 5 main areas, and it's really designed to assist small island states with their activities to try and reduce the incidence of NCDs. So one of the key parts of the roadmap is increasing taxes on tobacco. And if there's any interest in the group, I can talk a little more about that in the Q&A session. Because the NCD roadmap in the region has really shown some promise, where small islands have been able to have a coordinated, planned, evidence-based intervention to try and reduce the incidence of NCDs and risk factors. Next slide. NCDs, diabetes, heart disease, it's the largest cause of death in the region and globally, of course, causing 3/4 of all deaths. It's a significant cause of morbidity, mortality, blindness, renal failure. There continues to be high and rising risk factor burden, tobacco use, poor nutrition. Despite the best efforts of island nations and regional organizations and quite a lot of investment, we're not making a dent in the burden of poor health caused by NCDs. And it's more than just a personal health and family health issue. It is a drain on the development potential of many of these small islands. It primarily affects adults in their economically productive age groups. There are large and unsustainable costs of healthcare for very small health systems. A person on dialysis in Samoa costs $40,000 a year. Most of them are dead within 2 to 3 years. And of course, the problem is it's easier to start these things, not so easy to stop. And often the expenses are really directed at cases that are perhaps not, don't have good prospects of quality of life, but it's difficult, of course, not to offer these services to people. It can be catastrophic on families. As you will appreciate, there are no safety net provisions in the small islands except a few places. So it's pretty tough. One of the observations I would make is that there is excellent political commitment and leadership to tackling NCDs in the Pacific region. But unfortunately, it hasn't translated into resources needed to do the job. And I describe it as really trying to use a canoe kayak paddle to turn the Titanic. Next slide. Let me turn now to the climate crisis. This is a WHO slide that I've pinched. Climate crisis, climate change threatens your health. Doesn't matter whether you're in a big city, a rural village, or a small island. It is, of course, particularly acute in the small islands of the Pacific, and it affects pretty much all of the what we call in public health the socioeconomic determinants of health, the food we eat, the air we breathe, and the water we drink. The estimated additional deaths at the bottom there is pretty conservative, according to most people. Next slide. When people talk about the climate crisis, this is the picture that many people will have in their heads. It's dramatic flooding and great devastation, destruction of crops and property, and often injury to people. Next slide. But the real challenge for the Pacific is in fact due to less dramatic effects of climate change, like sea level rise and ocean acidification in particular. Sea level rise, of course, much has been made that some islands will sink, references to Tuvalu, Northern Cooks and Kiribati. And some of the projections and estimates are pretty heroic. My understanding of the science is that yes, it will happen, but it's likely to be not of the scale and people are talking about. But the real problem in the Pacific Islands is ocean acidification, primarily due to warming and of the sea temperature leading to coral bleaching. 80% of the protein source of the small islands of the region come from the sea, fish and seafood. And when coral dies, fish dies. And when fish dies, people will have to find alternative sources of food. So ocean acidification and coral bleaching is in fact potentially more harmful, more destructive, less visible, less dramatic, and often doesn't receive the attention of people. But it's probably the thing that many in the islands are concerned about, because the alternative would be to divert to purchasing flour and rice and tinned food, which will aggravate NCDs, as you can imagine. I described the climate crisis as an effect multiplier. By that I mean the climate crisis doesn't introduce new public health threats. It just makes worse what already exists. So if we look at water, many of the small islands don't have access to clean water on a regular basis. In parts of Papua New Guinea, less than 20%, some places less than 20% people have access to clean water. Even in Fiji, less than half of the population have access to clean water. And as you can imagine, the climate crisis will make that worse. Similarly, vector-borne diseases are endemic in the region, dengue in particular, and warming will likely spread these vector-borne diseases even further. There is, of course, a mix of things. Whilst there's droughts in parts of the Northern Pacific, Micronesia, Federated States of Micronesia, and the Marshall Islands, there's too much water elsewhere in the Pacific. Overall, I should say, having spent 7 years at SPC, we've tried really hard to encourage the small island states to develop and prepare considered health responses to the impacts of climate change. But at the time I left in December of 2019, it's still a problem area, I think, that many islands haven't thought through what their health policy and what their health responses would be to the climate crisis. Naturally, the leaders have been preoccupied with getting their voices heard, and I think they did that reasonably well in the Paris Agreement in December of 2015, I think it was. Most people, of course, didn't give the small islands of the region any chance of getting their voice heard, but I think they did a great job. And the Paris Agreement is probably the most important global instrument that people can rely on and refer to in terms of mitigating the effects of climate change. But the small islands of the region do need to step up and prepare specific, well-considered, evidence-based health responses to the increasing impacts of the climate crisis. Next slide, thanks. Just to talk now about the healthcare developments, status and impact. Several islands in the Pacific spend less than, you'd appreciate that healthcare in the islands is funded and provided primarily by governments. And several Pacific islands spend less than 5% of GDP on health. There is no magical number. There is no agreed threshold. But most people would tell you that if you spend less than 5% of your GDP on health, you're not likely to be able to provide the basic primary care requirements like full immunization, like births being supervised by a trained healthcare worker, and so on. Fiji, the Cook Islands, Papua New Guinea, all spend less than 5% of GDP on health. In other words, it's a fairly fragile arrangement, and there are a lot of calls on the health dollar. So everyone has a good justification as to why this service should be funded or that service should be funded. And whilst there's a lot of ODA assistance to the health systems and the healthcare sector in the small islands, the reality is there's not enough money to go around. And as a consequence, you would appreciate that the health systems are fairly fragile. And things like COVID, whilst many islands are fortunately COVID-free, they've diverted their limited skills, their limited resources to preparing for COVID. What this means, of course, is that diabetes care and other types of care is postponed, delayed, or cancelled, which is why the work that you do at ANZGITA is really important, because it is not possible for the small islands to fully fund the range of services that many of you would be familiar with and expected. So there's a very tough call on poor old health ministers in the islands being asked to stretch the health dollar as far as they can possibly make it. Fortunately, many of the islands have invested and orientated their healthcare systems to a very strong primary care model, and many have close to achieving universal healthcare coverage. The things that miss out, of course, are low volume specialist services, such as the service that you provide. And it's a constant struggle, constant challenge to provide quality specialist, low volume services to people in the region, often for conditions that we know in Australia and New Zealand, the affected person would have a pretty good life expectancy and quality of life. The New Zealand government funds a medical treatment scheme that bring selected people, a few people, to New Zealand for treatment and or specialists that go to the islands and provide services there. So, as I say, I've been at many discussions over the years about what is an appropriate model to structure specialist services such as yours, surgical services, cancer services, cardiology services, and it's a struggle. For the Cook Islands and Niue, they're fortunate, of course, that they can refer in all of their cases to New Zealand, but that's not something that's available right around the region. Fiji, of course, is capable of doing most of this themselves, and some of the other islands refer to Fiji, but it is a challenge for the region how best to structure and deliver specialist services. And so I commend you for the work that you do, and I note in the material that was shared, and much of it is voluntary. So I guess on their behalf, let me say thank you. The region, of course, apart from, and one of the consequences of a very small health budget is there's a chronic shortage of trained healthcare workers. In Polynesia, they train quite a number of healthcare workers, doctors and nurses, but they lose them to Australia and New Zealand and beyond. There was a time, of course, when they tried to bond. I'm guilty as charged. I'm one of those people, by the way. But I reconciled this to myself that the New Zealand government paid for my training, so I'm just returning the favor. But it is an issue, and if you talk to training institutions and health leaders in the region, that's why they focus on training people in the Pacific, because if you go to Australia or New Zealand, there is a chance that people won't go back. So there is a mix, of course, that need to be considered. There's no doubt that attachments in Australia and New Zealand for specific purposes is a good thing. But this loss of healthcare workers is a chronic challenge for many of the small islands in the region. The situation in Melanesia and Micronesia, of course, is a little different. It's not so much due to out-migration, they just don't train enough people. So these are the issues that need to be addressed. And whilst health is more about, health is to do with nutrition, good housing, and a whole bunch of other stuff, nonetheless, quality healthcare services makes a difference, as you know. Next slide, thanks. Oh, and this is really my last slide. The region has a lot of potential and promise. I think you can have a pretty good quality of life in the region, but things are not going well. Life expectancy across many islands appears to be static or declining. NCDs is probably the most likely cause of that. Some good news with the declining child mortality, but we're standing still and the rest of the world is gone past us. And somehow we've got to escalate the gains that we've made because the Pacific Islands as a region is slipping. The climate crisis, the health impacts of the climate crisis is not yet fully appreciated by the health leaders in the region. And this is something that I'll keep repeating because the health impacts of the climate crisis is potentially huge and compounded by the presence of NCDs. Mentioned earlier about the high and rising burden of NCDs, and frankly, the small island health systems and indeed the societies in the region, the impact of NCDs will be devastating. Very small, fragile health systems, chronically underfunded, and you know the drill about the workforce. So I do think, I want to say again, I think the work that you do providing in-country training and support benefits are immeasurable. I'd make a plea for continuing professional development education for colleagues in the region. So the webinars that you do sound fantastic. And as I say, I'm sure colleagues in the region appreciate the work that you do. Thank you very much for the opportunity to share some thoughts with you all.
Mm.
Thank you. Thank you very much, Collin. That was very illuminating and put our work in perspective. I'll throw up the first question. We have one from on the board already, but just on that topic, we struggle quite a bit as ANZGITA to work out where our place is in the complexities and demands in the public health space across the Pacific, and how best to I suppose, indicate what we can offer so as to gain its place, its utility in the Pacific. Can you give us some guidance about, you know, how we should approach that? We know that resources that come from the Australian government through DFAT are prioritised according to the priorities set by the sovereign countries across the Pacific. And we don't get much of a look into that sort of process, but perhaps you've got some clues to give us as to how we might approach that.
Yeah, money is important, but you know, it isn't always about money. Don't forget that you folk are leaders, professional people, leaders, and you know, statements, a shared statement, a collective statement from a body like ANZGITA on what needs to be done will have impact. So yes, funding is always helpful because it enables people to do things on the ground. But as I say, don't underestimate your leadership potential, your leadership contributions and your collective voice. Not talking so much to you as gastroenterologists, but you are health leaders, healthcare professionals. And if you make a statement supporting the need to act with some urgency around particularly the health impacts, not necessarily restricted to gastrointestinal disease and pathology, but health more broadly, that will have an impact. Australia, if I may say gently, been dragging the chain on climate crisis, and you really could influence Canberra with your voice. The Pacific Islands look to Australia and New Zealand for leadership on acting on the impacts of negative impacts of climate change. You can influence Canberra much more than someone in one of the islands, so don't forget that avenue. But as I say, it's really a question of leadership, collective voice, supporting the need for small islands to take effective action on the negative impacts of the climate crisis. Don't underestimate your ability to influence through your collective voice, and particularly to include the work that you've done voluntarily. I recall a figure of 15 years or however long you've been working in the Pacific, often under the radar, and people don't know the good work that you do. So you have every reason to make a statement about a challenge like the climate crisis. You've been providing support and training to colleagues in the region. You've been providing services, and you have every right to make a statement. These things are never direct and simple and straightforward, Finn, as you know, but your voice added to other voices will have impact, I'm sure.
Okay, good. Chris was up for some questions. I think you've probably covered his first one. But Chris, do you want to?
Yeah, that was my two questions, and Collin has answered the first one. Was should NGOs like ANZGITA have, a climate statement policy, and how should it be structured or used? And I think you've probably covered that already in a broader sense. And so I suppose my second question, Collin, was, if you indeed had the paddle, or if the paddle was slightly bigger, how would you use it to turn the Titanic of NCDs in the Pacific? What would be your priority steps?
Probably to encourage people to look more closely at what's called WHO best buys, the simple things that we have good evidence from around the world that if you implemented those consistently and with some urgency, you'll make a change. Taxing tobacco is one that comes to mind. Taxing alcohol, there was tax interventions appear to have impact. There are treatments that we know work for things like diabetes and high blood pressure, medication that's effective that are not being used. Many people in the islands with diabetes don't get the care that they need. And we know that even people with high blood pressure, modest cost medication available on a consistent basis will make a difference. Simple things like aspirin for someone who's had an infarct. I don't know what it costs, but aspirin is dirt cheap. And it's not available. So the islands will tell you they have an essential medicines list, but if you actually look at the list, quite often the nurses in the village or the outer islands cope as best they can with the medication run out for several weeks at a time. In other words, the supply of proven medication for conditions such as diabetes and high blood pressure are not being treated. Professional training and support and development for your colleagues in the primary care about diagnosis and proper treatment of these conditions. Many of the people with diabetes, for example, are not diagnosed, so they picked up coincidentally when they got off to do something. You know, we're not talking about big, expensive, complicated things here, Chris. You know, it's really applying consistently, simple things that we know have good evidence to support. And I just gave you the example of treatment, for example. The decline in cardiovascular mortality in Australia, New Zealand, the Western world, not all of it was due to reduction in smoking. Some of it was due to treatments being given out consistently. So they would be the kinds of things I would be looking at. In other words, policy at a political level to influence those decisions, and then support for clinical colleagues, professionals that are on the ground doing the job.
Oh, good. Tony Clark, did you have a question?
While Tony's coming in, Finn, there's a question from Peter Catalaris to Collin. How would you tackle obesity problems in the Pacific?
With great difficulty. You see, if I knew the answer to that, I'd be a rich man. The problem, of course, in the region is huge. Pardon the pun. It's the obesity capital of the world, and it's a question been asked many times before. Lots of things starting at the policy level about food policy, food systems. The real issue in the region is that we import half to 2/3 of the food that people eat, and a lot of that is not necessary. So they import flour and rice and some soft drinks and tinned fish, tinned beef, instead of eating traditional diets, and that's the big one. And if you can figure out how to turn that around, we'll be making progress. But trade in food, importation of processed food and sugars and sugar-sweetened beverages is a big one. And even in places like Fiji and Tonga and elsewhere that can grow a lot of their food, people are increasingly preferred imported food. So the food supply issue is a big one. There's some evidence from WHO STEP surveys that people are becoming more active. And so that needs to be continued. But this here is about community physical activity that appeals to people, like, you know, walking and games and those sorts of things. It's a big challenge, but fundamentally, at the end of the day, it's about the food supply and what people eat and their physical activity levels. There is a move in the region for what's called ending childhood obesity, and perhaps focusing on the children in the early days and early learning centers and children, because, you know, once your eating habits are established, they're established for life. So there's a move there to try to improve the nutritional intake of children and young people, and to limit advertising of food and soft drinks around the islands. The problem, of course, that much of the food that are imported here, they're made outside the region, Australia, New Zealand, the US, and Asia. So clearly a difficult problem, and you need to act at different levels, from, you know, the policy level down to the individual level and community initiatives in between. So it's clearly recognized that one of the big challenges of the Pacific Islands, and it's probably going to be a while before any of that is changed.
Because I suppose that touches on a follow-up question that Peter had, Colin, about if you see any political will to drive a change in diets.
Oh, it's a popular thing, I guess. You know, most politicians say the right thing. It's like limiting the availability of alcohol, but they're the worst offenders when it comes to alcohol misuse and alcohol harm. It's the same with obesity. They say all the right things, but often unwilling to limit the importation of certain food items, for example. They say all the right things about tobacco and smoking, but they're smokers themselves and unwilling to make the changes.
Okay.
And so I suppose, having worked in this area for a long time, I guess the challenge is, as I say, to try to support health systems to implement those so-called WHO best buys, the things that we know work, as well as education, social media campaigns, and campaigns more broadly targeting community groups. There's on the upside, there's a lot of awareness around at the moment about the harms caused by obesity, for example. It's just that we're still a little short on effective interventions that we know can change prevalence of obesity in the region. It is truly one of the big challenges of the region.
There is one more question, but I think if we promise people, I'll let you, Darwin. We'll come back if Colin can stay just a bit longer for one or two more questions. Yeah.
Okay. Well, we promised we would wrap up on time and then stay on questions. Finn, to you.
Yeah, so Colin, thank you very much for sparing the hour with us. We've got 24 or 25 participants who've been online all the time listening to your wisdom about the region. You talked a lot about climate change, and I'd just like to say that we are involved in the climate change area, especially through our linkage, and we do have a strong linkage with the World Gastroenterology Organization. And indeed, on our website is a paper that I co-authored with our colleagues in Canada on the gastrointestinal health implications of climate change. Mei-Ling Perman is part of that. She's as you know, one of our major trainers in Fiji itself, and she's actively engaged in that World Gastroenterology Organization climate change sub-organisation within it. So it's on our agenda, to be sure, Colin. So it is at the hour. Thank you very much. Thank you, Chris, for your presentation as well. Thank you for everybody for joining in to this, the first members meeting outside an annual general meeting. And Frank, did you want to run the poll now, or is that, how's it going to be done?
You're muted, Frank. Yep.
Oh, so we just wanted to know what you thought of these meetings. Should we hold them 4 times a year, 2 times a year, or just an update at the AGM and that's enough? So if you could just complete that, that would be helpful for us. How do you do that? Oh, we can't vote.
We can't vote. Yeah.
We'll give you another 10 seconds.
Hang on. We don't need to get the results now, Finn. It's just a bit of
We'll
feedback.
post them. Yeah.
Okay, so all members, keep your ears open for opportunities to participate, whether it's within the virtual training process, within the WhatsApp group as we struggle on under COVID, you know, perhaps even after we've given it more consideration in the COVID space that I mentioned. And keep in touch, and we'll be keeping in touch with you. And thank you very much for your engagements tonight. Thanks. We'll carry on for any who want to stay with some further questions with Collin.
Finn, we had a question from Vikash Sharma in Fiji, which Chris has provided some answer to, but it's an interesting question from a more general perspective. So for Collin, in that the issue around, you had lots of small communities in the Pacific, and everyone, well, it might be an overstatement, but everyone's sort of running a procurement system, whether he feels that there's any opportunity for the nations in the Pacific to work more closely together to streamline procurement of items, you know, like medical supplies.
The New Zealand Ministry of Foreign Affairs and Trade is currently talking with the Polynesian countries, not all of the islands, but the Polynesian nations, about a shared or a group procurement arrangement with the New Zealand Pharmac for medication and devices, is my understanding. There's already been quite a lot of discussion about bulk purchasing of pharmaceuticals, for example. The Australian government and the Japanese government were involved in the building of a central regional pharmaceutical depot in Fiji some years back, and they did proceed down the line with bulk purchasing of pharmaceuticals across the region. But as with some of these things, it ended up that Fiji, I think, was left holding the baby because some of the members didn't pay their bills on time. And so that idea collapsed, is my understanding. But it's been tried several times before, Frank, shared purchasing. There is a current project with the New Zealand government for the Polynesian nations. I mean, in theory, the potential is there. The practice, of course, often causes some difficulties and people become gun shy. So, yeah, I think there's a recognition of the potential benefits, but the practicalities are that some of these things have been tried before and haven't been as successful as had been hoped.
Okay, thank you. No more questions have come up, Barb, so.
Okay. Well, the webinar series is on the website. Just a reminder for people anybody who wants to join those, that they are there with the links.
Well, Finn, Barb, Chris, Frank, and the team, thank you very much for the invitation. I hope my contribution was useful, and thank you again for all the work that you do in the region. I'm sure everyone appreciates it. Thank you very much.
Okay, thank you, Collin.
Thank you for your time. It's a pleasure.
Thank you very much, Collin. It was nice to meet you.
Yes.
And nice to meet you all. Good night.
Good night.
I guess that concludes the evening. Thanks, everyone.
Okay, thanks, Finn.
Yay, well done, everybody. All right.
Yep.
I think we need to talk to Bill Gates.
Yeah.
Wouldn't that be great?
Yeah. Okay, all right. Okay, well, everyone's dropping off there, so that's good. Thanks, Barb.
Okay. You recorded it?
Yeah, it's recorded. I'll
Okay.
stop that now and, yep, stop the cloud recording.